Good evening, good afternoon, and good morning. This is the 1806th day of continuous daily webinar conducted by International Forum for Promoting Homeopathy. IFPH comprises of homeopathic students, lovers, and doctors. Let's begin the session with a silent prayer. Thank you, everyone. A quick reminder that we all are celebrating 5th anniversary of IFPH on 28th September at Cochin, Kerala at Taj Vivanta. So on behalf of IFPH, I request everyone to register earliest. So now uh, our session time. As you all know, IFPH is conducting every day. Am I audible?
Yeah, you are audible. You can continue.
Yes.
Okay. Sorry for the interruption. So as you all know, IFPH is conducting 3 uninterrupted sessions every day from 7:30 p.m. to 10:30 p.m. The recording of the same is available on the very next day, so that who missed the session can watch the session and get benefited from it. And also you can subscribe the channel without paying any money. So today's our guest and speaker is Dr. Samir. Dr. SAMIR CHAUKKAR. Dr. SAMIR CHAUKKAR is Dean at Dr. Batra's Academy and has vast academic and practical experience with various colleges and universities in India and abroad. He has conducted numerous seminars on homeopathy in Australia, New Zealand, Canada, USA, Malaysia, Belgium, London, Turkey, and other countries. He graduated in 1992 from CMP Homeopathic Medical College under the aegis of Mumbai University and completed his post-graduation in 2005. He has completed post-graduation diploma in addiction treatment from Canada. In addition, he has successfully completed HMD and PG from London and fellowship from Maharashtra University of Health Sciences. He has been teaching and practicing homeopathy in India and has been associated with Dr. Batras for the past 10 years. He has also handled the post of head training and served as chief homeopathic consultant with Dr. Batras Homeopathy. Dr. Samir endeavored to spread the benefit of homeopathic education through Dr. Batras Academy. So today's his topic of the seminar is addiction and homeopathy. Now I proudly welcome Dr. Samir to start his sessions and share his knowledge with us. Dr. Samir, over to you.
Thank you, Dr. Shruti. Can you hear me?
Yes, sir. Yes, sir. You are audible.
Okay, so, Dr. Shruti, you have given an excellent introduction. I am humbled by the introduction. Just one thing, my name is not Dr. Samir, I am Dr. Samir. It's a very simple name. So,
sorry, sir.
No, it's okay. I'm just kidding. No problem. Don't worry. It's a simple name. Samir is a very, very simple name. So it's not like some Britisher Gregory or something like that. It's not very difficult. But anyway, so thank you, Shruti, very much. And good evening, everybody. So we are meeting after some time. Last time we talked about batch flower remedies. We talked about autism. So Dr. Ram Pravesh sir is there. Namaste sir. Kaise hain? And Dr. Sahani is not there, unfortunately. It would have been my luck if he was there, but he's not there. So anyways, so today I'm going to talk about a very, very important topic in which I think I started my career with this topic because when I finished my graduation in 1992, I was always interested in treating addictions. I don't know why. Not that anybody at my home was an addict, but then I was intrigued by the subject addiction, and I always wanted to learn about addiction, which made me go to Canada in 1999 and 2000, and I did my addictions post-graduation from there. So 2 years I was in Canada. I was working in a hospital in Guelph, which is very near to Toronto. And there we were seeing a lot of patients of addictions. And I was about to settle there. Everything was decided, but my dad expired. And today, in fact, is the date when he died. So all my gratitude to him. 11th August was his day when he died in 2000. and I had to come back from Canada because of this. So in a way, it was my luck or bad luck that I had to come back. But then when I came back here, I thought that there are many patients here in India who are suffering from this problem of addiction, and I should use whatever knowledge I have of addictions treatment, not only homeopathy but counseling and psychology, everything that can help these patients to recover from addiction, because addiction is a family disease. This is the first thing that I want to tell you. It is not only the addict. Till a long time back, everybody was looking at the addict. Everybody was focused on the addict, but nobody looked at his wife, nobody looked at his children, nobody looked at his dependents. But now the focus has changed to a family disease and codependency. Remember, so it is not only the dependency but codependency. That means who is dependent on him or codependent on him, like his wife, his mother, his father, his children. They are also the patients and they also require treatment. Remember that. Because until and unless the family is treated, the addict cannot be treated, and addict cannot recover without a wife being educated of how to treat the addict. Because you see, one thing is that any alcoholic who drinks a lot and falls in the gutter, this is what our image is of alcoholic. ये gutter में गिर जाता है, इतना पीता है कि gutter में गिर जाता है. So that is our picture of an addict. But addict is not like that. Addicts, kitne bhi piye, they come back to their home. They know their home. They never forget their home. Remember that. Whether it is 12 o'clock, 1 o'clock or 3 o'clock in the night, they will come back home. They are drunk. They will sleep on the bed, and what the wife does, अरे आओ आओ आओ, फिर उनके जूते निकालना, शूज निकालना, चादर डालना, खाना खाओ, आपके लिए मैंने आज खाना नहीं खाया, आपके लिए मैंने व्रत रखा है, ये रही थाली, ये दाल भात है, and the addict throws that thali, still the wife will gather. This is what is called codependency. This is what is enabling the addiction. इससे उनका addiction कम नहीं होगा but बढ़ेगा, because he knows that there is a support available. That the wife is always available to remove his shoes, to remove his socks, to put chaddar on him, to give him food. He knows that everybody is available for him. जब तक ये support उनके हाथ से निकलेगा नहीं, तब तक उनको recovery के बारे में कुछ भी पता नहीं चलेगा. And this is the first thing that I want to emphasize today, that all of us should know that it is not only important to treat the addict, but also the family and take care of the whole family. Remember, because the family suffers more than the addict. Remember, I can say it because I've seen it, how wives and how children, they suffer because of the addict. Because addict drinks and he really forgets, and the mother, the wife would say, जब ये पीते नहीं तो बहुत अच्छे आदमी होते हैं, पीने के बाद इनके अंदर क्या होता है मालूम नहीं, एकदम शैतान बन जाते हैं. This is what happens. So okay. So let's talk about homeopathy and addictions. We'll talk about batch flowers also, and we'll talk about general counseling and what is codependency also. So what is addiction? Let's talk of addiction as a big umbrella. Remember, it is not only drug, it is not only alcohol, it can be internet, it can be religion, it can be love, it can be sex, it can be anything. Addiction एक बड़ी umbrella है जिसके अंदर ये छोटे छोटे addictions आते हैं. So drug addiction is a chronic, often relapsing. Remember, ये जो चीज है वो क्रॉनिक है और रिलैप्सिंग है, कभी भी रिलैप्स हो सकती है. देयरफॉर इट इज सेड, वंस एन एडिक्ट ऑलवेज एन एडिक्ट. रिमेंबर. सो इट कॉजेस कंपल्सिव ड्रग सीकिंग. माने यूज करना ही इंपॉर्टेंट नहीं होता है, कहाँ से मिलेगा, वापस वापस वही दिमाग में चीजें आती रहती है. दे जस्ट कीप ऑन थिंकिंग ऑल द टाइम दैट व्हेन इज माय नेक्स्ट अल्कोहल और व्हेन इज माय नेक्स्ट ड्रग, वेयर इज इट, शुड है. इसके लिए वो लोग पिल्लों के भी नीचे रखेंगे, टॉयलेट में भी रखेंगे, टॉयलेट के ऊपर भी रखेंगे, टेरेस पे कहीं पे छुपा के रखेंगे, हर जगह उनका स्टैश होता है. अल्कोहलिक लैंग्वेज में या एडिक्शन लैंग्वेज में एक होता है स्टैशिंग. स्टैशिंग का मतलब होता है कि कहीं ना कहीं छुपा के रखना, बिकॉज इनको इतनी इनसिक्योरिटी होती है, अगर मेरी आखिरी बॉटल भी खत्म हो जाए तो फिर कहाँ से मिलेगी मुझे बॉटल, तो ये सब छुपा के रखना. सो कंपल्सिव ड्रग सीकिंग एंड यूज डिस्पाइट हार्मफुल कॉन्सिक्वेंसेज, ये ड्रग एडिक्शन का मेन थिंग है कि मुझे मालूम है दारू पीने से या कुछ भी कोई भी चीज जो एडिक्शन की जैसी है उसको करने से मुझे नुकसान होगा, मेरी फैमिली को नुकसान होगा, मुझे बच्चों को नुकसान होगा, फाइनेंशियली, लीगली, मेडिकली मुझे प्रॉब्लम होगा, फिर भी मैं उसको रोक नहीं सकता. दैट इज एडिक्शन. रिमेंबर, अगर मैं रोक सकता हूं तो उसको एडिक्शन नहीं बोलेंगे हम लोग. रिमेंबर दैट. जब तक इसके लिए बहुत सारे लोग होते हैं जो रोज रात को एक पैग विस्की या एक पैग वाइन पी लेते हैं और सालों साल पीते रहते हैं, बट ना ही उनको मेडिकल कोई प्रॉब्लम होता है, ना ही लीगल प्रॉब्लम होता है, फैमिली वगैरह सब कुछ ठीक चल रही है, कोई प्रॉब्लम नहीं है। इसके लिए लाइन बिटवीन डेली यूज एंड एडिक्शन इज वेरी वेरी थिन, रिमेंबर। कभी वो आदमी पार कर जाए वो लाइन, वो आपको पता भी नहीं चलेगा, रिमेंबर दिस इज वेरी वेरी इंपॉर्टेंट। So addiction is just not about sex, drugs, and rock and roll. One can be addicted to gambling, food, tobacco, stimulants, prescription drugs, tranquilizers है, sleeping pills है, Prozac है, exercise. कितने सारे मेरे पेशेंट्स बोलते हैं 4-4, 5-5 घंटे जिम में जाते हैं, इतने जिम में जाते हैं कि हाथ पैर दर्द होने लगते हैं, फिर भी उनको एक तरह से मजा आता है, एक तरह से किक मिलती है। तो ये भी एक एडिक्शन। तो एडिक्शन सिर्फ ड्रग्स और अल्कोहल का नहीं होता, ये सब्सटेंस का नहीं होता, बट प्रोसेस का भी होता है। प्रोसेस एडिक्शन माने गैम्बलिंग हो सकता है, शॉपलिफ्टिंग हो सकता है, कंप्यूटर गेम्स हो सकते हैं, टेलीविजन हो सकता है, आजकल ओटीटी है। और पोस्ट पैंडेमिक मोस्ट इंपॉर्टेंट इज छोटे छोटे बच्चों को कंप्यूटर और लैपटॉप और टैबलेट्स का एडिक्शन हो गया। हम सब लोग देखते हैं आज हमारे बच्चे खाना खाते वक्त भी टैबलेट्स लेके कुछ ना कुछ करते रहते हैं, कंप्यूटर लेके कुछ ना कुछ करते रहते हैं, मोबाइल लेके कुछ ना कुछ करते हैं। ये एक पैंडेमिक बन गया है और वो पैंडेमिक की ट्रीटमेंट हमें करनी जरूरी है, और होम्योपैथी में इसकी जरूर ट्रीटमेंट है। बहुत सारे फैक्टर्स जरूरी है, एक सिंगल अवेलेबिलिटी इज नॉट इम्पॉर्टेंट, जेनेटिक प्रीडिस्पोजिशन भी इंपॉर्टेंट है। तो ऐसे नहीं कि अल्कोहल इजीली अवेलेबल है तो मैं अल्कोहलिक हो गया, हाँ एक वो रीजन हो सकता है, बट ऐसे बहुत सारे बच्चे लोग होते हैं जिनके पिताजी अल्कोहलिक रहते हैं, एक बच्चा अल्कोहलिक बनता है, दूसरा बच्चा अल्कोहल नहीं लेता। सो दैट इज वेरी वेरी इंपॉर्टेंट। सो मेनी फैक्टर्स इंक्लूडिंग जेनेटिक्स, environment and behavior influence a person's addiction risk, making it an incredibly complicated disease, remember that। अगर DSM-4-5 में देखेंगे, जैसे डायग्नोस्टिक एंड स्टैटिस्टिक्स मैनुअल है अमेरिकन साइकेट्रिक एसोसिएशन का, जिसे हम बाइबल कहते हैं साइकेट्री का, उसमें एडिक्शन को एक डिजीज माना गया। पहले उसको बहुत सारी चीजें मानी जाती थी, जैसे मॉरल मॉरल प्रॉब्लम है, जैसे आदमी खराब है, जैसे भगवान का श्राप है, ऐसे माना जाता था। बट अभी उसको एक डिजीज माना जाता है, और DSM-4 में उसके क्राइटेरिया है सब्सटेंस डिपेंडेंसी की। नंबर 1 इज टॉलरेंस। टॉलरेंस का मतलब क्या है? नीड फॉर मार्केटली इंक्रीज अमाउंट्स ऑफ सब्सटेंस टू अचीव द सेम इफेक्ट, markedly diminished effect with continued use of the same amount of substance। जैसे जैसे मैं लेता रहता हूँ वैसे मेरे क्वांटिटी बढ़ती जाती है। आप आज देखते हो, आज अगर आपको कॉन्स्टिपेशन है और आपने एक दवाई एक गोली खा ली जिससे आपका मोशन थोड़े लूज हो गए, ठीक है, 2-3 दिन लिया आपने, ठीक रहा, तीसरे चौथे दिन देखोगे एक या आधी गोली से ठीक नहीं लगेगा, 1.5 गोली करनी पड़ेगी। तो ये डोज आपका बढ़ता जाएगा। वैसे अल्कोहल हो, ड्रग हो, गैम्बलिंग हो, कोई भी चीज का जब डोज बढ़ता जाता है टू गिव द सेम काइंड ऑफ इफेक्ट, टू सेम गिव द सेम काइंड ऑफ किक, उसे हम टॉलरेंस कहते हैं। रिमेंबर दैट इज नोन एज टॉलरेंस बिकॉज इट इंक्रीजेस इन increasing the amount. Next is withdrawal. Withdrawal means, you know, that if you are not getting that substance, you are not getting that activity which you are addicted to, you will become very irritable, short tempered, frustrated, throwing things here and there. That is known as withdrawal. एंड द सेम सब्सटेंस इज टेकन टू रिलीव और अवॉइड विड्रॉल सिम्टम। आप देखते हो बहुत सारे लोग जो शराब पीते रहते हैं, दिन भर शराब पीते हैं, रात भर शराब पीते हैं, सो जाते हैं, सुबह उठ के उनके हाथ कांपने लगते हैं। जब तक वो थोड़ी शराब पीते नहीं तब तक वो काम नहीं कर सकते। दैट इज नोन एज विड्रॉल। रिमेंबर, substance is often taken in larger amounts and in longer period than was intended। ये बढ़ते जाता है, डोज बढ़ते जाता है, एंड वो छोड़ने की भी कोशिश करता है पर छोड़ नहीं पाता। सो देर आर परसिस्टेंट डिजायर। ये सवाल उसको पूछना बहुत जरूरी है, क्या आप छोड़ने की कोशिश कर रहे हो? हाँ, मैं कोशिश तो बहुत कर रहा हूँ पर छोड़ ही नहीं पा रहा हूँ। आप उसके लिए क्या कर रहे हैं? हाँ, वो कुछ कर नहीं रहे, वो बात अलग है, पर छोड़ भी नहीं पाते। सो अनसक्सेसफुल एफर्ट्स टू कट डाउन और कंट्रोल द सब्सटेंस यूज। लास्टली, वेरी वेरी इंपॉर्टेंट इज दे कीप ऑन थिंकिंग अबाउट इट। आज कैसे लाऊंगा, वहां कौन सी ट्रेन जाती है, वहां कौन सी बस जाती है, अगर दवाई चाहिए तो अलग अलग डॉक्टर के पास जाना है, अलग अलग मेडिकल स्टोर में जाना है, कितने लॉन्ग डिस्टेंस को ट्रैवल करना है, कैसे मेरा सब्सटेंस में लाऊं, ये सोचते रहना। तो ये थोड़े क्राइटेरिया है। रिमेंबर, ये क्राइटेरिया बहुत जरूरी है डायग्नोसिस के लिए। सोशल, ऑक्यूपेशनल, रिक्रिएशनल एक्टिविटीज भूल जाते हैं हम लोग। घर में किसी की बर्थडे है, बच्चों का बर्थडे है, मैरिज एनिवर्सरी है, या कुछ दूसरा इंपॉर्टेंट इवेंट है, भूल जाना और उसी में सोचते रहना कि मेरा सब्सटेंस कहाँ से लूं। एंड सब्सटेंस यूज इज कंटिन्यूड डिस्पाइट नॉलेज ऑफ हैविंग परसिस्टेंट रिकरेंट फिजिकल साइकोलॉजिकल प्रॉब्लम। तकलीफ हो रही है, पेट में दर्द हो रहा है, एसिडिटी हो रही है, गुस्सा आ रहा है, हाथ पाँव में दर्द कर रहा है, ये सब इफेक्ट्स है अल्कोहल के या ड्रग्स के, बट फिर भी बिना लिए मैं रह नहीं सकता। एडिक्शन इज रह भी नहीं सकता और ले भी नहीं सकता, दैट इज नोन एज एडिक्शन, रिमेंबर, एंड दैट इज द नोन एज अ रॉक बॉटम। ऐसे कोई कोई शब्द है एडिक्शनोलॉजी में जो वेरी वेरी इंपॉर्टेंट है, जैसे स्टैशिंग मैंने कहा था, वैसे रॉक बॉटम इंपॉर्टेंट। जब तक वो आदमी रॉक बॉटम तक नहीं पहुंचेगा तब तक वो सुधरेगा नहीं। रॉक बॉटम का मतलब है मैं पी भी नहीं सकता और बिना पिए रह भी नहीं सकता, दैट इज नोन एज रॉक बॉटम, रिमेंबर। सो व्हाट इज द मोस्ट इंपॉर्टेंट क्राइटेरिया? एक तो लैक ऑफ कंट्रोल है, मैं कंट्रोल नहीं कर पाता, विड्रॉल सिम्टम्स ऑन नॉन गेटिंग द सब्सटेंस, इंक्रीज डोज रिक्वायर्ड टू गेट द सेम इफेक्ट, continuously thinking of how to procure the substance and using it in spite of negative consequences। ये 5 चीजें हैं, ये हर एडिक्शन में कॉमन रहती है, भले वो एडिक्शन एक्सरसाइज का हो या लव का हो, रिलीजन का हो, दारू का हो, ड्रग्स का हो, marijuana का हो, स्मोकिंग का हो, कुछ भी हो, इसमें लैक ऑफ कंट्रोल जरूर रहेगा। अगर सब्सटेंस नहीं मिलेगा तो विड्रॉल होगा, डोज बढ़ते जाएगा, कंटिन्यूसली हम सोचते रहेंगे और फिर भी हम लोग यूज करते रहेंगे। अगर खांसी भी आती है तो भी स्मोकिंग तो मुझे करना ही है और बिना किए मैं रह नहीं सकता, राइट? सो दैट इज नोन एज क्राइटेरिया फॉर सब्सटेंस डिपेंडेंस। प्री डिस्पोजिंग कॉज अगर होम्योपैथिकली देखा जाए तो अपना जेनेटिकली अगर देखेंगे तो उसको माइजम भी बोला जाएगा। नाउ एडिक्शन में दो चीजें होती है, एक तो आदमी बदल जाता है, रिमेम्बर, ब्रेन की जो साइकोलॉजी होती है, जो जो हमने मुन्ना भाई में देखा था, केमिकल लोचा जो कहा था, वो प्रॉपर एक वर्ड था केमिकल लोचा, माने देयर इज अ केमिकल इम्बैलेंस, आदमी गलत तरीके से सोचने लगता है। तो इसके लिए साइकोसिस माइजम और सिफिलिटिक माइजम, उसमें बहुत सारी प्लानिंग, कनिंगनेस, मैनिपुलेटिव, डिसीटफुल, ये सब साइकोटिक सिम्टम्स आ जाते हैं और डिस्ट्रक्शन आ जाता है, बिकॉज इट इज अ सेल्फ डिस्ट्रक्शन। इसके लिए प्री डोमिनेंट माइजम एडिक्शन का साइकोसिफिलिटिक रहेगा। और जो भी दवाइयां हम सिलेक्ट करेंगे, अगर कॉन्स्टिट्यूशनली देनी है तो स्पेसिफिक देनी है तो बात अलग है, अगर कॉन्स्टिट्यूशनली देनी है तो साइकोसिफिलिटिक ही देने पड़ेंगे। एट द सेम टाइम एनवायरमेंटल स्ट्रेसेस कुड बी देयर, कि कोई टेंशन आ गया, नौकरी चली गई, फैमिली में झगड़े होने लग गए, पर्सनल ऑफिस में कोई प्रॉब्लम हो गया, तो ये प्रेसिपिटेटिंग कॉज हो गया, ये एक्चुअल कॉज नहीं। जेनेटिकली ही इज प्री डिस्पोज, रिमेंबर, ये प्री डिस्पोज था आदमी, इसके लिए इसको इन चीजों से फर्क पड़ा। जैसे हम ऑटिज्म की बात कर रहे थे तभी मैंने आपको कहा था कि जेनेटिकली वाज प्री डिस्पोज और फिर वैक्सीन लग गई तो वैक्सीन की वजह से हो गया। तो वैक्सीन इज नॉट द कल्प्रिट, रिमेंबर, द कल्प्रिट इज जेनेटिक प्री डिस्पोजिशन था और वैक्सीन। वैसे ही एडिक्शन में भी जेनेटिक प्री डिस्पोजिशन था, फंडामेंटल माइजम था और एक्साइटिंग कॉज की वजह से एडिक्शन आ गया। तो दैट इज व्हाट इज ऑल अबाउट कॉजेज ऑफ एडिक्शन। अगर एलिमेंट्स फ्रॉम देखेंगे एडिक्शंस का तो देयर आर मेनी, डिसअपॉइंटमेंट इन लव भी हो सकता है विच इज द कॉमनेस्ट, then there could be discord. I'm sorry, Maureen, I am speaking in Hindi. I did not know you're there, so I'll speak in English. So otherwise, you're going to curse me, isn't it? So I'll speak in English. So as I said, something important was the predisposing cause and precipitating cause. In homeopathy, we talk of genetic. I mean, there has to be a genetic predisposition without which the exciting cause will not even touch you. Remember that. So similarly, until unless you're predisposed to alcoholism or predisposed to drug addiction because of the psychosyphilitic miasm, the environment like stress, family, professional, interpersonal cannot really touch you. Remember, because fights, stress is everywhere, but not everybody becomes alcoholic, not everybody becomes drug addict. Only those people become addicts who are genetically predisposed, right? The common causes are disappointment in love. You look at our complete repertoire and look at the ailments from chapter. You look at disappointment in love, discords in family, abuse, a very, very important thing for addiction. Remember, many girls, many boys have these, haunting memories of abuse in the childhood. It could be physical abuse, sexual abuse, any kind of abuse, but this often leads to addiction, remember. So these unresolved feelings of abuse will usually lead to addiction in the future, remember. Indignation, insults, mortification, loss of ambition, that means failure in the exams, loss of near and dear one. Remember, bereavement is one very, very important thing. Remember an old couple, they are staying together, the children have gone away, they are suffering from something called empty nest syndrome. Remember that. Okay. And the child is not there. The old couple are for each other. And suddenly one partner dies. What happens to the other partner? He doesn't know what to do. getting bored the whole day sitting at home. What are they going to do? They are taking tranquilizers. Along with, they start thinking that, okay, if I take alcohol, I get a kick. I tend to forget my partner, and those memories, they don't come back. And he starts taking a lethal combination of tranquilizers and alcohol together, and someday may even die because of that. Remember that. So it's very, very important to find out the real cause behind, the real constitutional person behind, right? Now, always you say that there are certain character defects. I mean, there are certain characters who are prone to addiction. Either you have to be too much assertive, remember, too much aggressive, or too much passive. These are the people who will be prone to addictions. Those who are passive, they lack self-esteem. They are shy, they are timid. People easily use them as doormats, and they really don't have any self-esteem. So therefore, in order to show that they are powerful, in order that they have strength, they will start drinking or they'll start using. At the same time, on the other hand, there'll be an aggressive personality who will start using because they are aggressive. They want to show their aggressiveness. They want to show their domination. So either an aggressive or a passive personality will be prone to addiction. A egoistic personality. A personality who goes into self-pity or martyrdom. Feeling of being wronged or used. A person who always feels humiliated, insulted, frustrated. A frivolous person who does not have any responsibility, like our belladonnas, remember that. Adventurous risk taking, like tuberculinum. Remember tuberculinum tarantula. Remember tuberculinum tarantula, the spiders and the snakes. Very, very important remedies for addiction. Remember, very, very important. And of course, peer pressure. Nowadays, all the youngsters are facing it, peer pressure, due to which they start using. Remember that. There are many, many types of addictions. As I have told you, there could be drug addiction or substance abuse, which contains alcohol, nicotine, cocaine, opiate, you name, heroin, meth, methadone, caffeine, steroid, and on and on. At the same time, there is something called process addiction or behavioral addiction, which is gambling, food addiction, sex addiction, love addiction, porn addiction, work addiction, exercise addiction, video game addiction, shopping addiction, gadget addiction, and on and on. You see, after pandemic, what has happened? All the children are glued to their tablets, they're glued to gadgets, and the mothers, the fathers, they just don't have any clue of how to release them from that gadget, because taking that gadget away from them gives rise to a lot of behavior which is so much antisocial. They will start becoming shouting and violent and destructive, and the parents, they just don't know what to do with this gadget addiction. Remember, it's a challenge for us as homeopaths in the future. Remember that. In homeopathy, there's a belief in the miasms, the inherent weakness or taint that manifests in future generations. Medicine recognizes the hereditary component of many diseases. Homeopathy takes it one stage further and includes conditions that are not genetically mediated. It's common to see family members share the same or similar remedies and therefore behavior patterns. If the men in the family internalize their problems and drown themselves in drink, the child will learn that in their family, this is the way to deal with life. Therefore, the father, who is a role model, if he starts drinking, that's how the child also knows. Because then he sees that the father gains some kind of, strength when he starts drinking. And he feels that, okay, my father is able to face all the problems that a husband faces or that a father faces only when he drinks. So therefore, even I should start drinking. Maybe that will help me to study. That's how a child can become the addict, remember, right? The emotional issues that have been long buried, remember we were talking of abuse, long buried under the wheel of alcohol, drugs, overeating, or compulsive shopping, must be addressed sensitively and conflict should be resolved. With assistance, a new sense of self will emerge, a stronger, more stable individual who is able to deal with stresses of life without dependence on an external prop. It really takes real courage to embark on the hero's journey, and rewards are immense. Remember, the treatment of addiction is challenging. Remember, it's not easy. Never ever just think of only Nux vomica or sulfur for any addiction. Remember, addiction is a deep disease. It doesn't just go away by some specifics, tobacco here and there, and camphor here and there, or Nux vomica here and there. Until unless the person is Nux vomica, the addiction will not go. Remember, it might subside for some time. Your Nux vomica may act for some time. Your sulfur may act for some time, but it will not keep the individual free from addiction for long. Remember, because it's not only the medicines or the homeopathy that will help, also the counseling, the therapy, telling his wife, telling his daughter of how to behave with him is very, very important. Otherwise, the addict will never come out of the clutches of addiction. Remember, Homeopathy is an important role to play as it views the whole person as a unique individual. Remember, the first step in any successful treatment program is for the person to admit that there is a problem. Now, this is the thing that always the addict would say that, doctor, do you think I have a problem? I don't have a problem. I drink because my wife is like this. I drink because my mother is like this. Drink because my mother never treated me properly. Always they will blame others for their habit. They will never take the onus of addiction, remember. So the first duty of us as homeopaths, as counselors, is to break his denial. He should understand that he has this problem because of himself and not because of anybody. Not because of his mother, not because of his wife, not because of his children, not because of his job. It is because he wants to drink that he started drinking. Remember, it's very, very important. So when living in the delusion that this isn't a problem, I can stop drinking whenever I want, there is no way forward. So till the person says that, yes, I can stop whenever I want, no problem. That's why in the 12 steps, the first step is acceptance of powerlessness. That's why these 12 steps, the first step says that God grant me the serenity to accept the things that I cannot change, wisdom to change the things. So this is the serenity prayer that every addict. I was working in a de-addiction center for around 10 years, and this is what we were taught, and this is what we were teaching patients. Remember that. So denial of the problem must be faced first. This is not as easy as it may sound, remember. The two main factors which motivate most addictive behaviors are desire for sensory pleasure and avoidance of pain. These are the two things. There can't be a third thing. Why do addicts use, or why do some people get addicted? Because they want pleasure, which comes very easily. And second is there is some pain behind which they want to avoid, they want to suppress, they want to mask, remember. Therefore, if you remember, there is a remedy called agrimony in batch flowers, which is a very, very important remedy for drug addiction. Because these people have some pain which they mask. Outside, they show that everything is normal. They smile, they make jokes, just like Robin Williams. Remember, just like Charlie Chaplin. These were the best comedians. They laughed, they smiled, but inside they had a lot of pain and depression, remember. And that's why agrimony becomes a very, very important remedy in batch flowers for addiction. So always think of agrimony for addictions, remember. At the root of all addictions is the unfulfilled need for love and acceptance, which leaves the person unhappy with themselves. Childhood traumas, very, very important, leave behind painful, unprocessed feelings. These feelings cry for release, and free expression of such feelings activates healing process. While I have seen people overcome mild addictions with homeopathic treatment alone, severe cases are more successful with added support from a psychotherapist, counselor, 12-step program, or other support groups. Remember, very, very important. Don't think as homeopath that you will be able to take care of the addict and his home. No, you cannot. It is a teamwork. You need a psychologist, you need a counselor, you need a support group, you need winners. Remember, who are the winners? Those who tell him that don't drink, it's not good. Those are not winners who will say, okay, you come with us to the bar, you don't drink, we will drink. You take a Coca-Cola, I will take a whiskey. No, by the time the party gets over, I am taking whiskey and he's taking Coca-Cola. Remember that. So never ever stick to the winners. That is one of the the motto of addiction. Stick to winners. And who are these winners? Winners are those who are going to tell us, no, drink is not good for you. Smoking is not good for you. And I am not smoking, you're not smoking, we are not smoking. That's how it is. Okay. This is the tree of addiction. Very nice figure that I really love, which tells us everything about addiction. Now remember, this tree of addiction grows in the soil. Which is the soil? The soil is a predisposing factor. The soil is physical abuse, which has been happened long time back. Spiritual abuse, sexual abuse, emotional abuse, hereditary factors, lot of shame, fear, grief, anger. These are the roots and the soil of addiction. And what comes out is a whole tree which has different types of addiction. It could be alcohol, drugs, religion, sex, gambling, codependency, work, anything. So now we all know that the type of addiction is not important, but from which soil it is coming and what is the soil made up of. So we are going to treat the soil, not the type of addiction. Don't say that this is a specific remedy for alcohol addiction, that is a specific remedy for nicotine. No, no, no. Think of the think of the soil. Think of the soil. Think of the root of addiction from where this tree is coming. That is a tree of addiction. Remember. My own experiences with addiction I would like to share with you. Now, what homeopathy can do? What are the homeopathic approaches? One is the tautopathic application of the abuse system. That means many a time for nicotine, I have used nicotinum, remember. Alcohol, I use alcohol in potency also. That is tautopathic application. Cannabis for cannabis, cannabis indica in potentized form, I use for cannabis addiction also many times. Not always successful, remember that. Remedies for acute system. Now, many a times the addict first comes up with cold, cough, fever, body pain. You have to treat these acute symptoms also, remember that. Because many a times he uses or he is cunning enough to tell you that, doctor, when I start drinking, my physical pain goes away. So don't fall into the trap of the addict, remember. Treat him with homeopathy and tell him that you don't need to drink alcohol. We've got enough good remedies like Rustox and Bryonia and Phytolacca to take care of your musculoskeletal systems or even cough, cold and fever also. And the third thing is constitutional stimulant, which you will take after taking a proper case of an individual. So two ways, acute treatment and chronic treatment, remember that. At the same time, there are some remedies for withdrawal effects. Those are known as acute remedies. There could be a de-addiction phase where the body is paining, cold, cough, coryza, joint pains are there. Third is a rehabilitation phase. That means he has stopped alcohol now and you need. So don't think of giving him a constitutional remedy in acute phase of withdrawal, remember. In acute phase of withdrawal, you will require acute remedies like aconite, belladonna, hyoscyamus, stramonium, because he's really angry and violent that you have stopped his alcohol or stopped his substance, remember that. So that kind of violence only will be covered by Solanaceae family, and that is belladonna, hyoscyamus, and stramonium. When he's able to stop after 7 days, 10 days, when the withdrawal effects go away and he becomes cooled down, though the urges are there, but he may not really run out to take drinks or alcohol like that. But he's comparatively stable after 7 to 10 days. After that, you can think of a constitutional remedy. And by chance, unfortunately, if he doesn't follow the program properly, he might relapse. Because you're not making him a dry drink. Remember, there are individuals who don't drink, who have stopped drinking, but go home and hit their wives. They are verbally abusive, they are physically abusive. They will go home and shout at their children, they'll throw things. Do you think this person is not an addict? He's still an addict. And therefore we call it dry drunk. Dry drunk का मतलब ये है, he is not drunk, but he's still drunk. In a way, dry drunk means he still has the character defects of an addict, though he's not drinking. And this is the person who will be likely to be getting relapse as soon as possible. Therefore, you have to take care that he doesn't relapse, because he has not changed his behavior at all. Stopping drinking is not stopping addiction, remember. Stopping alcohol, stopping smoking, or stopping any bad behavior, I shouldn't say bad, but wrong behavior, is not addiction. Changing a 360-degree change in the person can bring change in addiction, remember. This is very, very important. The patient can present with a chief complaint of alcoholism or drug addiction in the stage of withdrawal, de-addiction, and rehabilitation. Look for the original unmodified picture. Hahnemann in his Organon has talked about unmodified picture. That means tell the person to be away from whatever he's taking for some time and look, the original symptoms will come. But if he is coming totally drunk and you have to manage him, you'll have to look at the symptoms, whatever it is, just like what Dr. Hahnemann has said. Also ask from other relatives, his spouse or relatives and his children about what he is like. Patient coming to us with secondary alcoholism, we will have to find out the PQRS symptoms. By secondary alcoholism, I mean somebody who had stopped and who has started alcoholism again. Are you getting it? So there is primary alcoholism and secondary alcoholism. What are the sources of data? Spouse and the children, relatives, colleagues, friends, your own observation, and of course, lastly, the patient himself, but in a lucid interval. That means when he's not drunk. Because when he's in drunk state, he cannot say anything about himself. Find out whether the person is conscious or inebriated, cooperative or not. Okay. Depending on the stage, whether it is a withdrawal stage or de-addiction phase, find out the original unmodified picture of the disease. Also try to find out the PQRS symptom when he's sober at lucid interval, remember. Okay. Now, one more important thing I wanted to share with you is that, is the remedy enough? No. So there is a lot of counseling and psychotherapy involved, What can a parent do to reduce a child's screen time? Remember, which is a common problem. Every second parent comes to you saying that, okay, my son has cold and cough, but the second problem is his gadget. Even while eating, he requires a gadget. Even while drinking, even while going to school, he requires a gadget in his hand. So be the parent. It is your job to encourage healthy behaviors and limit unhealthy ones. Sometimes this making unpopular decisions. Remember, make this tough decision. Therefore, in addiction, there is a terminology called tough love. Whether the person is drinking, using alcohol, shoplifting, it is known as tough love. Means there is love, but be tough. Make these tough decisions for your children and always go the next step of explaining why you have made the decision. Don't just tell your child, nahi, use nahi karna hai. Stop using it. I will not allow you to use. Tell him, sit with him. Always go to the next step of explaining why you have made this decision. This will help them follow through, and sometime they'll choose it for themselves. Not immediately. Of course, it is not a quick fix, but still something that we can. Set limited viewing times. This is one very important thing. You have to study when you have to study. You have to eat when you're eating. If you want to use your gadget, you will get this much time. So if you're not going to turn off the television completely, choose the appropriate television viewing windows, timings for your kids. It is much easier to limit their viewing habit if they understand that they can only watch one show during the day. Encourage other activities. Now, this is again very difficult. You cannot tell a kid to read books or play something. Our kids are so much addicted to gadgets that they will not like anything else until unless it is very, very interesting. Until unless you also play with them, remember. This is one thing that I have experienced with my kids, that the day I started sitting with my kids and talking to them and playing with them, that gadget thing has literally gone away. Remember. Okay. Is it worth it or deemed fit? Don't buy a gadget because your children want to fit in with the social circle. Buy it only if you are convinced of its utility and if it fits your affordability. Play with your kids. This is one thing which is very, very important. Spend more time with your kids. Now, again, with this busy world, with nuclear families where the mother and father both are working, the child is left to a caretaker. How will you expect this to happen? But we'll have to find out ways. Remember, I am not giving you 100% sure shot, solutions, but these are some solutions that we can try. For example, get down on the floor with your kids and pick up a doll. It takes intentionality and selfless love when they are younger. But when they grow up, you will be glad that you did it. Remember, be involved in their lives. Know what your kid is doing. Know where your kid is going. Find out who are the friends that he's playing with on the gadget. Very, very important. Create tech-free zones at home. Remember, like on the dining table, never ever bring the phone. You also you be a role model. Remember, today's fathers and mothers also carrying their mobiles at the dining table. Why won't the kids do? Because the kids, they see the father, kids, they see the mother. So keep them in a basket. Tell everybody that, okay, when you come for dinner, keep them in the basket. I am keeping my phone in the basket. Everybody keeps it in. Okay. Let's look at the kids, or let's look at the people who are at the most risk. If we look at even comparing with the rubrics in the repertory, low parent supervision or communication. If there are a lot of family discords or family conflicts, you can think of natriumure, magnesium car. Inconsistent or severe parental discipline. If you've got a parent who's like Merksol or anacardium, you are going to develop children like carcinosin, silicia, lycopodium pulsatilla. Remember that. Very, very important. History of physical or sexual victimization, where Staphylococcus aureus, CPI, Ignatia can come. Children or adults who always like thrill and adventures, like tuberculum, tarantula, lachesis, phosphorus, agaricus. Those in show business, competition, modeling, movies, think of lachesis. So even a occupation or even a profession can tell you what the remedy could be. Remember, those who are in marketing, those are in competition, they will always be snake remedies. Lot of show off, lot of competition, lot of shining. That's very, very important. Remember. Depending on the cause, again, these are very, very small things. They can be more also. So death or bereavement, emptiness syndrome. I have seen Ignatia, phosphoric acid for disappointment in love, loss of position, veratrum, even lycopodium, financial loss, arnica, aurum, loss of ambition, nux vomica, physical or sexual abuse, anacardium, lysine, mercury. Remember, very, very important. Miasmatic travel. This is very, very important. One of the most interesting slides. It all starts with Sora. Of course, I told you the predominant miasm is psychosyphilitic. But it starts with Sora, where there's a lot of experimentation. There's a lot of competition. There's a lot of feeling that, okay, what will happen if I smoke? One smoke and let me see what will happen. So there's a lot of inquisitiveness and experimentation. Starts with Sora, goes into psychosis, where there is cunning, manipulative, stealing things, deceitful, lying, egoistic, stealing, frauds, hiding nature, deceitful, fixed ideas of procuring. Fixity is psychosis. Many times it goes into the tubercular, where there's a lot of risk-taking behavior, audacity, reckless, impulsive behavior. And lastly, when you don't get the substance, you don't get what you want, you turn homicidal, suicidal, destructive, anger, violence, abuse you on your wife, abuse you with your children, throwing things here and there, embezzlement, stealing, frauds. Therefore, psychosyphilitic. Think of remedies which are psychosyphilitic, which will take care of the person constitutionally, remember. Now, if you're thinking of specifics, as I told you, you can think of specifics many times, constitutional also, but I wanted to show you both the approaches today. If you're thinking of like alcohol, of course, there are many remedies in the repertory, but I have seen what agaricus, very, very important, arsenic, aurum, china, crotalus, as I've told you, many snakes and many spiders. Sulfur, a very, very important remedy, ranunculus bulbosus, another very, very important post-alcohol, remember. Narcotics, think of Avena sativa, Nux vomica, opium, tobacco. Heroin, Avena, chamomile, again heroin, a part of morphine and opium. Nicotine, think of tabacum, Staphysagraria, ignatia, very, very important. Morphine, again Avena, ipecac, Nux vomica. And cocaine, again Avena, coca, very, very important. Gelsemium and Nux vomica. Now, medorinum is one nosode that I use frequently, and it is one of my favorites in addiction. Remember, it has a very, very particular type of addictive personality, because the first thing that Vitulka says in his Materia Medica is polarity. These are the people who are of polarity. That means one time they are very, very happy, on the other time they could be very, very irritable. Remember. So there's a lot of polarity in medorinum, which makes it's a epitome of addiction. Remember, one of the most important remedy for addiction. Again, lot of ice, sleeping on abdomen, gonorrhea, increased sexual desire, very, very important. And night people, remember. Medorinum, even in autism, I've seen children who are very, very hyperactive in the evening and night. The mother would say that he just does not sleep. In the day, he may be dull, but in the night, he becomes very, very active. Alcohol also is like that. Addiction is also like that. And therefore, medorinum is an important remedy for night people. Okay. Argentum nitricum, again, craving for sweets, impulsive, hurried. Carcinosin. Remember, reprimands, abuse in the childhood can lead to the person becoming a carcinosin. Remember that. Depending on the stage of disease, in withdrawal stage, you can use mostly, as I've told you, Solanaceae family. Stramonium, Hyoscyamus belladonna. Think of Nux vomica also, lysine also, like the rabid mad dog, remember. And alcohol withdrawal is one of the worst withdrawal. In the first 7 days when alcohol is stopped, the person can even die, remember, because he has got such horrific visual hallucinations. He will see insects, spiders, snakes here and there, and he will die because of that, remember. For that, you will require remedies like stramonium, hyoscyamus belladonna, remember. Very, very important. You really need to take care. At times, you may have to give him some injections, allopathic, some drips here and there in order to cool him down, remember that. Don't ever think of treating withdrawal in your clinic. Don't say that my homeopathy can do everything. You can literally kill a person in alcohol withdrawal. Remember, it's one of the most dangerous withdrawal of all drugs. Remember, though we feel alcohol is okay, drugs are bad. No, drug withdrawals are much lesser than alcohol withdrawal. Remember. De-addiction, as I told you, cold, cough, fever, pain here and there. Think of Restox, Nux vomica, Allium, common acute remedy. And of course, in the rehabilitation phase, when all the withdrawal symptoms are gone, think of a constitutional remedy. Temperaments. Remember, Dr. Parinaz Umranwala was the first who talked about various temperaments. So there are many temperaments. The 4 main are sanguine, choleric, melancholic, and phlegmatic. So sanguine are the happy people, always, having fun. So think of Ferrum, Foss, Lachesis, Coffea. You can think of temperaments also in alcoholics or drug abusers. Choleric are the very, very critical people. Now there is a remedy in batch flowers which is known as beech, which is very, very critical and intolerant. These alcoholics, these drug addicts, these users, addicts, they are quite intolerant, remember. They are very, very critical about everything. You can think of beach or nux vomica there. Melancholic, of course, natrum urignatia. And lastly, the phlegmatic, the lazy people sitting on the sofa, having pizza and putting on a lot of weight. Think of calcarea carp, pulsatilla, antimony crude baryta. So an addiction can be approached through many ways. That is what I want to tell you. There is no single way. Depending upon how the patient presents, that's how you start treating the person, remember. So depending upon the personality traits, this is the one thing which I have created. On the outer side are the personality defects. That means the person is like that. He's grandiose, defiant, low self-esteem, self-pity, impulsive, resentment is there, justification is there. But what are the remedies inside? Arsenic, lycopodium, like these are all common remedies. Addiction remedies are not different from our normal remedies. They are the same, remember. Okay. Alcoholism, again, hereditary cravings, withdrawal to help from insomnia. Avena is a very, very important remedy. Avena, passiflora, these are two important remedies for sleeplessness of alcoholics. They just cannot sleep, remember. They just need to use. Now, if we look at some remedies, we'll talk about some important remedies. Nux vomica, of course, a great anti-alcoholic remedy, we all know. But it is the most important remedy for tremors, nervous affection, headache, bad taste in the mouth, delirium tremens. Therefore, I told you in the acute stage of withdrawal, you can think of Nux vomica, remember. Nux vomica can really help the person if he's in the acute stage of withdrawal, remember. Sulfuric acid, again, but sulfuric acid is associated with a lot of acidity, remember. Lot of burning, lot of sourness at the edge. And he always needs to put alcohol in everything in order to make it tasty, remember. Chronic alcoholism. Cannabis indica, again, too much liveliness, too much talkativeness. It's very, very jovial, remember. So it is a remedy for acute alcoholism, remember. When he becomes too much elated, Delirium tremens over and over again. Stertorous breathing, remember. Opium, very, very important. The body is all red and he feels very, very hot. He wants to lie on a cool ground, remember, just like sulfur. Lachesis, visions of snakes and hideous objects, choking sensation in the throat, awaking from sleep. Common symptoms of lachesis, but remember they can happen in an addict also. Lachesis, again, a very, very, very important remedy for alcohol withdrawal, especially when he's seeing snakes around, just like lac canana. So lachesis and lac canana, visions of snake around, remember. Tobacco is yet another thing which is very, very common. And we have remedies like caladium, staphysagria, plantago. Caladium is a very, very important in order to. So impotency after prolonged use, smoker's cough, remember spongia, very, very dry cough, smoker's cough. Irritability when trying to quit smoking, think of nux vomica. Plantago causes an aversion to tobacco. I have used plantago in mother tincture, remember. Give the mother tincture to the person 10 drops 3 times or 4 times in a day, and he really develops kind of, aversion to tobacco. Tabacum is the homeopathic tobacco, remember. Caladium it influences the symptoms of the respiratory disturbances associated with smoking. Nux vomica helps smokers from becoming too much irritable. Avena sativa helps maintain vitality. Daphne indica helps insomnia associated with trying to quit smoking. Helps with tobacco cravings. Plantago, staphysagria, very, very important. But staphysagria also see that it could be a constitutional because of too much humility, suppressed anger, throwing things, breaking things, not able to speak out, suppressed emotion. Think of staphysagria along with agrimony. Remember, I told you about agrimony. See, these are the batch flowers that I use in addiction. First is agrimony, where there's a mental torture behind a cheerful face, like our magnesium carb and lac canana. Then beach, intolerance, critical, arrogant, like arsenic, lyco, nux vomica. Centauri, I told you, low self-esteem, mild, timid, doormats. They cannot say no to anybody. Let's go for drinking. No, I've stopped drinking. Arey, come on, nothing will happen. Okay, I'll go with you. Cannot say no. Think of Centauri. Clematis, who are daydreaming, lazy, no efforts on their own. Crabapple, There's some problem in my body. I feel I cannot leave alcohol. The obsessive compulsive neurosis, OCD disorder, think of crab apple. Very, very important. Cherry plum, lack of control. Very, very important. Fear that the mind will give away. Chestnut bud, failure to learn from mistakes. Chicory, very, very selfish, possessive love. Gentian, a little drink and I have gone into relapse. Now I need to drink more and more. Gentian, primary depression. Remember. Gorse, total helplessness and despair. Willow, self-pity and resentment. Scleranthus, cannot decide. Either I should go there or go there. Should I stop alcohol or I should not? Honeysuckle, I am living in the past. Larch, no confidence. And walnut, okay, I have stopped drinking now, but there are people around me who are drinking. There are a lot of beer shops around me. What should I do? Take walnut because walnut will help you, protect from the influences from outside. So these are the flower remedies. Okay. Addiction treatment must help the individual stop using drugs, maintain a drug-free lifestyle, and achieve productive functioning. This is very, very important. Our remedy or rehabilitation should put the person back into the society and he starts working for his family, work, and society. His addiction is typically a chronic disease. People cannot simply stop using drugs for a few days and be cured. Most patients require long term. So don't think of OPD treatment here. Let the person be in residential. Find out a residential facility. Like in Bombay, we have got Krupa Foundation. In Pune, we have got other foundations also. So in your city also, try to find out residential. There's nothing like OPD treatment for addiction. Please forget that. You cannot give him some medicine and tell him go home and come after 7 days. No, all 7 days he'll be drinking and he will never come back to you. His wife will come crying and she'll say, oh, my husband is not doing anything. He has to be admitted, remember. Yes, through homeopathy, you can motivate him to get admitted, but at least 3 months of residential treatment is important. Remember, I am always of the idea that he should be treated 3 months residentially and then he can come out and be treated with homeopathy. Very, very important. The healing process, whether it is done with homeopathy, talk therapy, or body work, allows unresolved feelings to the surface. Homeopathy can be helpful in quick processing of these feelings and helping the individual. 5 minutes ago. Homeopathy is a natural healing system that helps restore balance and harmony in the organization. Homeopathic remedies are prescribed for the whole person, not just isolated symptoms or disease label. In a typical consultation, a homeopath collects information pertaining to all your physical symptoms and emotional well-being. A homeopath looks at your traumatic life events and your reactions to these events. A remedy is selected accordingly. It helps build motivation and resist addictions. It will also facilitate interpersonal relationships. The totality of the person should be taken into account. It is not only physical de-addiction, but mental, physical, and spiritual de-addiction. Don't look at physical de-addiction because that you can do in the hospital also. You put a drip, IV drip, and all his alcohol and drugs, they go out and he's all clean, but he's physically clean. He's not emotionally and mentally clean, remember, for which counseling and homeopathy will be required, remember. Homeopathy helps him to recover from bad effects of the substance and also gel into the society as an important member who can contribute towards its growth. The treatment of addiction is challenging but highly rewarding. It is essential that there is excellent communication and collaboration between professionals, assisting in a deep, trusting, non-judgmental relationship is established. Homeopathy has an important role to play as it views the whole person as a unique individual. Addiction, remember, always tell your patients and convince him that there is a way out. Okay, thank you very much. If you have any queries, this is my contact number. These are my emails. You can contact me anytime. As far as addictions and autism is concerned, I wouldn't say I'm master at it, but I see a lot of cases. Maybe we can share cases of addictions, autism, ADHD, and we can learn more. We are all students. Okay. Thank you very much. Dr. Danesh.
Thank you, sir. Thank you so much, sir.
Okay.
It was really a very insightful and very informative session. So I request all the participants, if they have any queries or question, either they can type in chat box or they can raise their hand also.
Anybody has any questions, please ask.
Sir, please move your PPT so that we can see if anyone raising their hand.
Yes, really, it's a wonderful session indeed. Homeopathy has its answer uh, to these addictions, and that's what the presentation is all about. You really rock the floor, sir. You have shown the beauty of homeopathy in all respect. You have shown the medicine, what are the medicine and how it works and what are the conditions. Everything you were explained. And what's your experience with these natural remedies? Whether it is more attractive than homeopathic medicine or whether it is working in tandem with homeopathic medicine?
So I use batch flowers along with homeopathy, and many times batch flowers I have found very, very effective, more than homeopathy also. Because ultimately, when you're giving homeopathy, you're again giving alcohol. At least that smell of alcohol comes, remember. And even that small smell is enough for a relapse, remember. And many schools of thought, they feel even one drop of alcohol is relapse, remember. Therefore, I see batch flowers, especially made in water or mixed in waters, are excellent medicines, especially cherry plum, crab apple, walnut are one of my favorite remedies which I've used for all kinds of addiction. And one thing that I want to tell everybody is that think of addiction as a bigger umbrella. Don't think of small addictions here and there, because they are just offshoots of the main umbrella, and that is known as addiction. We have to treat the addict, remember, not the addiction, which is very, very important. Treat the addict and also see his wife. Look at his wife, look at his children, tell them how to behave with him, tell them not to become codependent. Because until unless the wife stops giving food to him, until unless the wife doesn't open the door, let him sleep outside on the road. Remember, that is the treatment of addiction. You may find it inhuman, but that is the only way he'll change. Every time you let him come into your house and sleep on the bed, okay, and you remove his shoes, he knows that okay, मैं तो कितना भी पी सकता हूँ और वापस आ सकता हूँ मेरे घर पे. जब तक उसके घर के दरवाजे बंद नहीं होंगे, उसके क्रेडिट कार्ड काट के फेंक नहीं दोगे आप, उसका वॉलेट फेंक नहीं दोगे, घड़ी फेंक नहीं दोगे, और बाहर जाके सबको बोलोगे कि भाई किसी से भी उधार लेगा, हम नहीं देने वाले, आप उनसे हैंडल करो जो भी करना है, हमारे पास मत आओ. बिकॉज एडिक्ट टेक्स मनी फ्रॉम एवरीबडी एंड देन एवरीबडी कम्स एट योर होम टू आस्क फॉर मनी. So the wife should be strong enough. She cannot be the mild chui mui si palse tilla. She has to become CPI, remember. She has to become Nakswamika. She has to become Platina. चंडिका होनी चाहिए, चंडिका, तो ही वो एडिक्ट ठीक हो जाएगा, नहीं तो नहीं. ठीक है. राम प्रवेश जी बोलिए.
Thank you, Shruti Sarka, and congratulations, Dr. SAMIR CHAUKKAR, sir. Very nice, excellent session, great presentation for society. Addiction, mental addiction, behavior, and homeopathic remedy and batch flower remedy, very good result. Just not taking money, see, very good result for addiction. Very, very thanks.
Thank you.
Thank you.
Thank you very much. I'll take your leave. Thank you. I think there are not many questions. Yes, Maureen, you have any questions? Did you like the session? You can unmute yourself, ma'am.
Very much information. Dealing with this in my life right now. I am a homeopath. Sorry,
I'm sorry.
it's tough.
I understand.
I have an addiction to learning more about homeopathy.
We all
And
we
just
all are
keep
addicted.
taking classes.
Yeah. And as long as we also look at our wives and children and our own job, it may not be an addiction. But if we leave everybody and just look at homeopathy, then we are addicts. Remember that. Okay.
Yeah. So
Sure. Have a good day. You
yeah.
take care of yourself.
Thank you very much.
Thank you. Chalo. Okay. Bye. Thank you very
Madam,
much. We'll see you later.
Madam, please share your number
Yes,
so that we can contact you.
Sure. Maureen, you can contact us anytime. I'm there for you. If you want, you can we can always talk about your case and we can discuss you and we will try to help you. Okay.
Okay. Okay.
Thank you very much.
Thank you.
Yes,
Sure.
sir.
Dr. Danish, bye-bye. Dr. Shruti,
Sir.
thank you very much.
Thank you, sir. Sir, it was really very insightful, very structured, and so much tips were there so that we can use in our daily practice. I would like to hear more from you. If you have time, you can share your case studies also with us so that we can get more information and knowledge from you.
Sure, sure.
Okay.
Next time, if we can do a addiction too, where I can talk about cases and how to handle cases of addiction.
Yes, sir. Yes, sir. That was
Yeah.
really very wonderful session. So,
Okay.
and
Sure.
also I like to do that quick reminder also that we are celebrating our 5th anniversary of IFPH on 28th of the September at Cochin, Kerala at Taj Vivanta. On behalf of IFPH, I request everyone to register at earliest. So thank you everyone. Now I am handing over the session to our Malayalam team. Thank you, sir. Thank you everyone. Thank you all the
Bye-bye.
participants also.
Namaste. Bye-bye.
Thank you. Thank you. Thank you.